Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. Today we have an interview in action from the 2023 spring conferences, ViVE in Nashville and HIMSS in Chicago. Special thanks to our partners, CDW, Rubrik, Sectra, and Trellix for choosing to invest in our mission to develop the next generation of health leaders. You can check them out on our website, thisweekhealth.com. Now, on to this interview. All right, here we are from ViVE with another interview in action, and we're here with Ali Rahimi, doctor, I'm sorry.
Yeah.
I hate to forget that, with ALYKA Health, and it's great to see you.
No, it's very nice to see you too, Bill.
So we caught up before this.
That's right.
We had email exchange and then had a conversation. I'm really interested in ALYKA Health and the stuff that you guys are doing. Why don't you share a little bit about what ALYKA Health is about? Sure,
Bill. So I'm a practicing cardiologist, and my passion is in public health. And I recognize that there's care gaps that are left open every day. The average American sees their physician maybe 4 times a year. That's over 360 days a year.
Is it really 4? That sounds
like
4 times. Lot, actually.
Yeah, it is. That's if they make their appointments, right?
Right.
So there's 360 days that they're not getting that support. So the thinking is that let's create a personal digital health assistant that taps into 3 different layers of data, real time. We help bring in their EHR data, very curated and targeted. We ask them questions to understand their health behaviors and create a wellness report and other surveys. And then we also tap into home devices and wearables. With that data, we can now improve their health knowledge, improve their confidence towards increased resilience. And ultimately, the goal is to help close those care gaps. Our focus today is improving cardiovascular and mental health.
Interesting. So you do start with some of the EHR data.
That's right.
When you say curated, it's
very specific. We recognize the value of EHRs and the value that their portals bring, but there's a big repository of data. A lot of the data is static and not actionable. What we do is we curate that content. What are the elements of the labs that we would like you to know that we can do something with? So we'll bring in your creatinine, your hemoglobin, your lipid values, and with that, we know what medicines you're on, and we know what your blood pressure is. Now with the logic that's smart in the background, we can target that education and the insights that's multimedia to help you actually help improve engagement and close those care gaps.
So the next thing you do is you collect information from the patient.
That's right.
In the form of questions. Is it like a long survey, or
very
are you
brief,
dripping them out?
A minute at a time. So it's a couple questions. So one of the first surveys is health resilience. So we ask them 5 questions. How knowledgeable are you on your medical conditions, your medications? And then we ask them another 5 questions on confidence. Do you have the motivation, the skills, and the tools? And that creates their health resilience index on a scale of 1 to 10. And the goal is every 5 to 6 weeks we ask them these questions and then help improve their health resilience, because we know the more resilient you are, the more likely you're going to take your medicines, to keep your doctor's appointments, and to improve health outcomes.
That's fantastic. And then the other form of data you're bringing in is device data.
That's right, that's right.
A lot of devices, a few devices?
Very limited. So today we focus on what's the highest yield, your weight, your blood pressure, and the glucometer. So today it's self-entry. Next it's automated where we sync it in. We're also tapping into Apple Health Kit. So we'll bring in step data, your heart rate. So the next stage is wearables. But we want to be very mindful that it's not a data dump. We're not creating a file cabinet of all your health records and data. Let's be real smart about it so it's digestible. So folks can come into ALYKA, interact 5 to 8 minutes a day, come away feeling better and smarter and more engaged about their health.
So what outcomes would you like to drive? I mean, you mentioned these in the beginning, but I'm curious. So we're bringing all that data together. It's not a complete picture, but it's a more complete picture. This is why you said only two specific areas.
That's right. Well, we focus on the heart. 1 in 2 adults will have heart disease. Mental health, 1 in 2 will be diagnosed with a mental health condition. So you need both to be working well to accomplish those outcomes. And so immediately, hypertension, let's improve blood pressure. 1 in 2 adults have high blood pressure, but only a quarter of it is controlled. We know that folks, the treatment for blood pressure is very well known and very proven. It's folks understanding that it's a chronic condition, that lifestyle is associated with it, taking your medicines, changing your diet, those are important. Mental health is equally important too, that we address.
So, we talked about the tech side of this, but a lot of it's behavioral modification.
That's right.
Right? So how do you get me to do what I should do?
That's right. We have to get making healthy fun and enjoyable. So we've looked at social media, we've looked at Netflix, we've looked at how do folks keep you coming back for more. It has to be a multimedia approach. It can't be a 15-page after visit summary that's printed out because you're meeting some mandate. It's something that you go, it may be a recipe, it may be a daily trivia, a factoid, a blog that's 300 to 400 words that's speaking to you and not at you, and lots of video content. So it's interactive, there's scores, so something for everyone that you can interact with. And then we've made it fun. You're earning Ali coins and you level up, and the goal is to be able to also share the content. No different than LinkedIn or Facebook. You can share a recipe or share a factoid. Invite your friends and family so you can create that ALYKA community.
All right, we'll get back to our show in just a minute. We're excited. We have a great webinar for you in May, on May 4th at 1 o'clock Eastern Time. It is part of our leadership series on modern data strategies in healthcare. In this webinar, we're going to explore data-driven approaches to healthcare and how they can improve patient outcomes, increase efficiency, and reduce costs, which are also critical at this time in this juncture in healthcare. Our expert speakers will explore data governance, analytic strategies, anything that can help healthcare providers gain actionable insights from healthcare data. We would love to have you there, and we're excited about it. You can register on our website. Just hit the leadership series, Modern Data Strategies. It's going to be in the top right-hand corner of our website, thisweekhealth.com. You can discover how we are going to use data to be more efficient, effective in the modern healthcare system. We'd love to have you join us. Again, hit the website, thisweekhealth.com, top right-hand corner. Sign up today. Hope to see you there. Now, back to the show.
Well, if I'm with a medical group or if I'm with a health system, how would I engage with ALYKA?
So the opportunity is that we see ourselves as a partner to the existing infrastructure that they have. They may have multiple point solutions that they're using that they're not getting true value to themselves or true ROI clinically for their patients. And we partner with them, identify where their areas of need are. Obviously today it's cardiovascular and mental health, engagement. Lots of health systems, one of the challenges they have, folks aren't engaging in their portals. They paid so much for these expensive EHRs that are wonderful, but yet the engagement is poor. So we see that as an opportunity to interact with them and help improve that engagement through the use of ALYKA.
What's the economic model? Is it direct to consumer or direct to?
It's both. So we've done all the work in creating 3 years of software development and research, bringing this to market. We rolled it out to the market in October. Our first B2B client has signed on with 7,000 users. And so that immediately...
Is that an employer?
It's a health navigator that helps bring on payers, cloud support services, admin support services. So this one is a small payer that they brought on. But ultimately, the other opportunities are health systems. We're moving towards value-based care. They need help closing the care gaps. Hiring health coaches is very expensive. And then the other opportunity is direct-to-consumer. You've built it. Good health should not be tied to your employment or your geography, so you can go to the App Store, Google Play, download it, subscription-based, and you get healthy and happy.
Where do you get your content, your educational content? Do you develop that on your own, or is there...
So it's a bimodal approach. Right now, so we're a team of physicians, PharmD. Our content is brought together with our content writers. We follow evidence-based guidelines by the American College of Cardiology, the U.S. Preventive Task Force, American Diabetes Association. So we bring together our own blogs and factoids around that. Then the other opportunity is to partner with HealthWise. We partner with HealthWise to bring in curated content. One of the compliments they've given us is you're the only application that actually goes and curates our content as opposed to just providing it as a glossary. So if you have high cholesterol or if you've got a condition, we have gone and tagged that video to that. So if you have that diagnosis or that abnormal lab, what's below it is ALYKA University. Right then and there, rather than an H or an L for high or low, you can go on the spot and see a 2-minute video and learn more.
If people want to engage with ALYKA, how do they do that?
Right now, you can go to our website, www.alykhealth.com. You can go to the App Store, type in ALYKA Health, ALYKA Health, download the app, take it for a spin, give us feedback. We're constantly learning, auditing the content, auditing the UI. The compliments that we received so far, 5 stars. People really love it. The retention is great. And we believe we're as close as you can be to your doctor in the pocket, that virtual doorway to healthcare as an adjunct and partner, helping to close those care gaps with different solutions out there.
So if you project it out 3 to 5 years, what would you like to see happen?
ALYKA will be the most trusted, widely used personal health assistant that started closing care gaps around heart and mental health well-being. Next we go into maternal health. Next we go into the other areas that is very prevalent. We'd like to tackle disparities. We understand access to care is critically important. Can we make this something free to the community that they can have access to and help close those care gaps? Good care should lie in the hands of the individual and not only solely on the shoulders of their physicians or their health insurance.
Right, absolutely. Ali, thank you.
Thank you, Bill.
I
It was a
appreciate the
pleasure.
time.
No, thank you.
Another great interview. I want to thank everybody who's spent time with us at the conference. I love hearing from people on the front lines, and it's phenomenal that they've taken the time to share their wisdom and experience with the community. It is greatly appreciated. We want to thank our partners, CDW, Rubrik, Sectra, and Trellix, who invest in our mission to develop the next generation of health leaders. Thanks for listening. That's all for now.